Good afternoon, everyone. Thank you so much for joining us today. My name is Samuel Schallenberger. I am the Assistant Director for Orientation and Student Development in our College Programming and Orientation office here at the college in UChicago. We have been putting on these webinars all summer long. Hopefully you've gotten to join us before. If this is your first time, welcome. If it's your sixth time, also welcome. As a general reminder, this session, along with all of our other sessions, is recorded. So if you need to leave at any point or drop off or just want to revisit it at a later time, it will be posted to our College Programming and Orientation website within the week. I will pop that link in the chat so that you can check out everything that has already happened earlier on. But today's session is specifically focused on student wellness. So we'll be touching on UChicago student wellness as a whole, as well as various medical services, mental health opportunities and resources, health promotion support, USHIP, all of that great stuff that you may have questions about. We have the experts here as our special guests to take it away. So with that, I'm going to go ahead and pass it on over to our student wellness professionals. And at the end, there will be time for Q&A. So if you have any questions, feel free to pop that in the chat or in the Q&A function, and they will be addressing them at the end of their presentation. I'll hand it over to you all.
Thank you, Samuel. Hello, everyone. On behalf of all of my colleagues at UChicago Student Wellness, I'd like to extend a very warm welcome to all of you to the University of Chicago. So my name is Meeta Kumar, and I use gender pronouns she, her, and I'm the Executive Director for Student Counseling and Health Promotion. And with me today are two of my colleagues from our medical care unit is Marianne Harris, who's the Director of Clinical Practice. And from our health promotion team is Emily Scholes, who's the Assistant Director for Student Engagement. So we are here today to tell you about the array of wellness resources available to support you through your college journey. So a quick word about our mission. So at UChicago Student Wellness, we provide students with comprehensive medical, mental health, and wellness services to support the academic, personal, and professional success. And here we believe that wellness is essential for your academic success. So this is really important. There's a lot of information we are going to be covering. So please be attentive, but also everything is going to be available on our website. So we have a very large multidisciplinary staff comprised of physicians, nurses, medical assistants, psychologists, psychiatrists, social workers, and public health professionals. They are trained in addressing needs of college students, and we are a diverse group with various identities, backgrounds, and specialties. We are committed to providing care that is inclusive, and we consistently strive to support a diverse student community. So to best serve you, we are made up of three functional areas: medical, mental health, and health promotion support and programming. Throughout our time together today, we will go in depth into each functional area and the services that are provided. Most of our services are covered at no cost for students actively enrolled in an eligible program of study. If you're unsure if you are eligible, please contact your Dean of Students Office to determine your eligibility. UChicago Student Wellness is housed under the Provost and Campus and Student Life. So we want you to know, first and foremost, that we are here for you. Always. And as I mentioned earlier, you're receiving a lot of information this week. So if you get anything out of this presentation, I hope that you can remember the information on this slide. So we opened a beautiful new state-of-the-art Student Wellness Center in 2020. It is located at 840 East 59th Street near the intersection of 59th and Maryland. All of our staff, medical, mental health, and health promotion are housed in this one center. Now, please take a moment to take out your phones and save these numbers. If you need to contact us during business hours, please call 773-834-WELL. When you call this line, you can learn more about or access any of our medical, mental health, or health promotion services. If you need urgent assistance outside of business hours, please utilize the most appropriate after-hours resource. As you can see on this slide, we have a 24/7 nurse line at 773-834-WELL. Or if you're looking to reach a therapist on call for urgent mental health care, you can call the number 773-702-3625. There are also additional resources available through Timely Care, and I will go through those in just a little bit. For any emergency, always please know you can contact 911 for immediate assistance. And the University of Chicago Police Department is also available for any urgent or emergent help at 773-702-8181. Now we will take a more in-depth look at the three functional areas of student wellness and share some of the programs and services offered. So I will turn it over to Marianne to go over the medical care.
Thank you, Mifa. Welcome, everybody. I'm Marianne Harris, Director of Clinical Practice, and I'm going to talk to you a little bit about what medical services we offer here at the Student Wellness Center. So we are able to provide an array of services for you. Our medical team is a diverse interdisciplinary team of physicians, advanced practice nurses, and medical assistants that are here to serve you. Our clinic provides primary and acute care, along with routine services, such as if you need a physical. We also do specialized care, such as gynecology. We do laboratory testing here. We also do a lot of screening and education on sexually transmitted infections and have a very seasoned team that's able to provide care for you. We provide services for immunizations and assistance with care navigation. We have 2 nurse navigators that are able to answer questions and get you to specialty care if you're being seen for special disease or service or have a chronic care need. They can get you to where you need. We also have special care in regards to eating concerns and assessments. I think we can go to the next slide. So how do you make an appointment in the Wellness Center for a healthcare need? The best way to do this is to go to My Wellness portal, or you can call the number 773-834-WELL. We know that you don't always know if the ailment or sickness that you have needs a doctor visit, or maybe you just need some medical advice over the phone. If this is the case, we encourage you to call the 773-834-WELL to speak to a member of our staff during business hours for that medical advice. And we can get you to the right, point you in the right direction. In addition, we know that emergencies sometimes happen. We do not provide emergency services here at the Student Wellness Center. We are mostly, we do primary care or episodic care. But services for a more higher level of care, such as emergency services, can be obtained at UChicago Medicine. In the event that you're unsure, or if you're concerned that it is an emergency, please contact our center for assistance. If you would like help seeking care or understanding your condition, we have staff that can help you schedule an appointment or address insurance concerns or manage your medications that you've been taking or therapy that you've already been having at your home or need moving forward. Many of our medical services are covered by the student services fee and are not charged to the insurance, although some services will be billed through insurances. Please visit our website to learn more. And again, you could go to wellness.uchicago.edu/medical services if you have any questions. We also encourage that you do use the wellness portal to make your appointments. You can self-select which provider you'd like to see. We always encourage too that you come in about 10 to 15 minutes early for your appointment so we can give you the time that you need to address your concern. Next slide.
Thank you, Marianne. So as was mentioned earlier, UChicago Student Wellness also offers high quality, accessible, and culturally sensitive mental health care to address a range of concerns. I always like to tell students there's no issue that's too small or too big for you to reach out and access help. We see students coming in for a range of concerns, like how to manage stress, feeling anxious, worries about academic distress, relationship, family concerns, mood concerns, to serious mental health issues like battling depression, bipolar disorders. So we see a range of presenting concerns. So please know that we are well equipped to serve student needs. So through UChicago Student Wellness, we have a diverse team, as I mentioned earlier, of psychologists, social workers, psychiatrists, psychiatric nurse practitioners, advanced trainees, and more. So some of our services include short-term individual and couples counseling. I want you to know there's no set limit on the number of sessions. We really try to tailor this to student needs. We have a psychiatry team that can evaluate for medication needs and prescribe and manage that for students. And this is a long-term treatment model. So students can have access to psychiatric care for the entire duration of their academic experience if they so need. In addition to that, we also provide therapy and support groups for students where they can connect with their peers around shared concerns or shared identities. Some examples of this are support spaces for international students, students who identify with the LGBTQ+ community, students of color, and so on. We have clinical case managers who are available to provide referral services to providers in the local area community for long-term therapy needs or specialty needs that students may have. In addition, we also provide psychoeducational workshops on a variety of topics, including time management, other skills related to academic success as part of the academic skills assessment program. So there's a variety of different ways in which you can access mental health care at UChicago Student Wellness. So one of our really popular access points is Let's Talk. This is typically offered multiple times weekly through the academic quarter. And it's really a way to really lower the barrier if you're looking to have an informal, confidential, anonymous drop-in consultation with a counselor. That is a great way for you to access services, get connected, just be able to get some quick advice, consultation, and the information on the days and times is typically available closer to the quarter and should be visible on our website. If you're looking to just schedule a routine appointment with one of our clinicians, one of our counselors, the best way is for you to call the 773-834-WELL and just schedule an appointment with one of our clinicians. Again, for any self-identified urgent issue, it doesn't have to be a clinical emergency. If you really feel like you can't wait, you need to contact and have access to someone right away. Again, there's multiple ways. If you're looking there's 24/7, 365 days a year access to a therapist on call. And again, please note the number 773-702-3625. Someone is always available. During business hours, there's additional access. You can call our main student wellness number and ask for the on-call clinician. Again, please know that mental health services offered at UChicago Student Wellness are available to students in eligible programs, and there's no cost for any of these services. please, again, visit our website. There's a lot of more further information that's available. And if anything, I would encourage you just bookmark that. And that's a really great way for you to learn more about all of the things that we are talking about today. So there's additional resources, mental health resources available. So starting March 2020, we are offering additional access to Timely Care, which is a leading national telehealth company specializing in serving students. So this service is designed to increase convenience and access to mental health care and will complement the in-person and virtual services offered through student wellness. So again, all eligible UChicago students now have access to Talk Now, which is a 24/7, 365 phone and video on-demand access to a mental health professional about any concern. There's also scheduled counseling visits available with a licensed therapist, up to 12 sessions per year, and these reset annually, September 1 through August 31st. There's psychiatry care also available through a referral, either through us at UChicago Student Wellness or a Timely Care treatment team. There are additional Timely Care wellness sessions, weekly guided meditation, yoga group sessions, plus specialized sessions throughout the year to address an array of health and wellness needs. This service is available in all 50 states. So you can also bridge care when you are home, on break, in the winter break, or during the summer sessions. So we really are trying to expand access in a much more robust way to all of our students. Please create your free account. You can do that now by visiting timelycare.com/UChicago or just download the app. It's very easy and convenient to set up your account. And just on your fingertips, you can access any of these services that are also available to you. So with that, I will turn this over to Schultz to go over the array of health promotion supports and programs.
Hi, everyone. As Misa just said, my name is Emily Schultz. My preferred pronouns are she, her, hers, and I'm one of the assistant directors within our health promotion team within UChicago Student Wellness. Health promotion is something that might be new for some folks. So just for some background on what that is, health promotion programs are really designed to support you in your well-being by meeting where you are. We know everyone's coming from different backgrounds and different experiences. So we really want to make sure that we're meeting you where you are. Our health promotion team really approaches health and well-being from a holistic and inclusive approach. It includes, we really utilize this 7-facet approach that you can see on the screen here. Our 7 facets of well-being framework really stresses the importance of finding and maintaining balance within each of the areas of your well-being so that you can be holistically well, so you can be the best human that you can be, the best student that you can be, all of that. So the facets of well-being include emotional, environmental, intellectual, spiritual, physical, financial, and social well-being. So with that being said, here's a sampling of some of the different programs and initiatives that you can take advantage of as a student at the University of Chicago. So you can make connections with your fellow students through our Better Together programs. You can learn techniques to reduce stress and anxiety through our mindfulness meditation and restorative yoga offerings. You can learn how to recognize the warning signs and symptoms of a mental health crisis and how to support your peers with mental health first aid training. We have thousands of folks on campus, student, staff, and faculty who have been trained in that program. You can cultivate ways to use your strengths in support of your overall well-being with wellness coaching, which is a one-on-one conversation with someone on our staff. You can have one-on-one conversations with our staff to talk about your alcohol and or substance use. You can identify ways to gain more restful nights through our virtual Refresh Sleep program. You can build community on your recovery journey with our student recovery group. You can just take a break with Take 10, and you can get involved with one of our different student groups and advisory boards. So in thinking about accessing our health promotion support and programs, these are coming up really slowly. I'm sorry, 1 second. second. You can, we have a huge amount of students that are involved in our programming. So I'll go here first with get involved. We couldn't do the work that we do without our passionate students who take an active role in our advisory boards and our student groups. So if you're interested in getting involved in, health education or just supporting and giving feedback to our team, you can join one of these various different advisory boards or student groups. Many appointments in many programs and services offered by our team, they really don't require appointments. Some of them are group sessions, some of them are just kind of passive things. So you can learn more about that online. But for the services that do require appointments, such as wellness coaching or basics, students can schedule those appointments in the My Wellness portal or via phone at 773-834-WELL. I'll go through the wellness portal in a second. I know we've talked about it a lot, so I want to make sure you all know what I'm talking about. And then just another thing, all health promotion services are offered free of charge to all students. So using the student services fee. So if you're interested, if you're just, wanting to explore different things, come join us. We're happy to have you. And we'd love to see you at some of our different programming and events this coming up year. So our colleague who represents our UShip is not able to be here today. So I'm going to talk briefly about the University Student Health Insurance Plan, which we fondly call UShip. So we administer this insurance plan, and while all students are required to carry valid health insurance, UShip is one high quality option and is selected by approximately half of our students here on campus. All students are automatically enrolled in UShip each year. So if you're already covered, say by a parent's plan or just by your own, you want to make sure you waive that coverage no longer than October 14th. I believe that you'll get access to waive starting on August 1st. So once that comes through, make sure you waive it, and you will have to upload all of your existing proof of insurance in there too. So if you want to keep the plan for UShip, we recommend confirming that coverage as soon as possible, starting August 1st, so that you can access that coverage as soon as you need to. The plan provides coverage from September 1st through August 31st. And if you have any questions, because I know health insurance is really confusing, we actually do have 2 United Healthcare insurance reps who are available on campus to answer any questions you may have. So you can see here for support, you can contact them, you can email them, you can call 773-834-4543 and selecting option number 2, or you can just come on over to the Student Wellness Center, and we actually have at least one of them on campus every day so that you can come walk in, but just make sure you verify their hours before walking over. If you do have any questions about the student insurance plan, I encourage you to go to wellness.uchicago.edu/student insurance, and you can find more information there. All right, so the next thing that I want to talk through is the My Wellness portal. I know we've mentioned this a few times, but this is something that we rolled out last year, and UChicago Students Wellness really strives to make it convenient for students to make appointments, to communicate with your providers and clinicians, and to access your health records. So we have this wellness portal, and all registered students already have accounts. So you just would have to go to wellness.uchicago.edu/login, and you'll come to this login, and you just need to activate your account there. So once you log in, this is what the portal can look like. So the integrated platform allows us to facilitate comprehensive holistic care, and it will enable a lot of convenient features, including online appointment scheduling. There's single sign-on through your CNET, so you don't need to make up a new password or login, and you can do secure messaging with your clinicians. So some things that you can do on here: scheduling different types of appointments. For some health promotion and medical appointments, you can schedule through the wellness portal. For all of our therapy or counseling appointments, I would recommend calling. You can submit your required immunization records, view and print your immunization history. You can complete health histories and any required consent forms. You can communicate securely with our wellness providers and staff. You can also do self-check-in via your mobile device when you come into the Wellness Center, which is really nice. And you can also complete intake forms all on this portal. So it's a really nice one-stop shop for your medical and your health goings on here at UChicago. We can answer more questions about that in a little bit. So before we wrap up and I open it up to questions, something that we really like to hit home with students is that, we're here to support you. We are the, professional support, but there's a lot of other ways that you can support your well-being while you're here at UChicago. So here are 3 quick little tips that could help you there. So first, we encourage you to be proactive about your wellness. Identify your needs and develop a plan. You all are coming into a new environment. It's kind of a weird time in this continuing COVID time. So I'd really encourage you to do some self-reflecting, identify your needs, develop a plan so that you can really get connected and know what's going to come for you. Next is connecting with other people. So talking to people you trust and who can support you. So social support is a really protective factor for our well-being, and identifying folks proactively who can help support you, it can make a world of difference with your health and well-being. So getting your support network, it could be your parents, your guardians, your partners, your friends, whoever that is, making sure you're connecting with people consistently is really important. And then finally, seeking professional support. So we encourage you to reach out to Student Wellness and all other campus resources if you are in need. And remember that seeking help is a sign of strength. It's not a sign of weakness. So before I let you all, we go into questions and answers, I just want to give you all some ways that you can follow us. So we're pretty active on social media. So you can follow us either on Facebook or Instagram. There's separate QR codes there. And then our website is wellness.uchicago.edu. That's the one single website for all of the different functional areas of UChicago Student Wellness. And from there, you can learn about medical services, mental health resources, along with health promotion programming and services and UShip. So with that, I think we can probably open things up for questions and answers. I see there's some that popped up. And we just go from there. Let's see. Neetha, you might be able to answer this first one. So are there and Marianne, any supports in place to help students coordinate the care they get from UChicago professionals and then their previous doctors and professionals from home?
Yeah, I'll go ahead and take that. Thanks, Emily. Yes, absolutely. We know that a lot of our students come in with maybe some illnesses that were treated by a home doctor. We have 2 nurse navigators on site. They are able to connect with resources that we have at UChicago Medicine, our campus academic medical center, especially if you are far away from home. They can also facilitate getting medical records, getting a referral to another specialist if needed. So I would recommend that you just call the 773-834-WELL, and we can get you to a nurse navigator that can help kind of manage you through those questions with getting the care that you've been getting at home close to campus now. Thanks.
And yeah, so thanks, Marianne. And I can take that with respect to coordinating mental health care if you've had either therapy or psychiatric treatment previously. So like Marianne said, that happens a fair amount. So be proactive, set up a routine appointment with one of our clinicians. And obviously we will need releases from you, and you may need to give releases to your previous providers so we can communicate and figure out what your needs are and really make sure that there is a seamless coordination. Again, please just set up an appointment and talk to one of our staff members about the kind of coordination and continuity you're looking for.
Thanks, Marianne and Neetha. Marianne, you might be able to help with this next one. Do you have any services specifically for assisting students in terms of COVID? So diagnosis, after effects, all of that.
Yes, we sure do. I mean, the last few years we've been managing through COVID, and we certainly want to make sure that we know if a student has COVID before they come into the clinic. So that would be a situation where you'd want to call the Wellness Center. If you need to be seen in person, we're able to get you a rapid COVID test, especially if you're having new symptoms and you're not really sure what they are, but you feel like you want to be seen directly by a provider in person. We can get you tested right away. We also have PCR testing on campus. We can guide you as to where the testing is located. So that's another service that we provide on campus. We also have the option of telehealth. So if you have a health-related need, similar to our mental health partners, we do have virtual options to be seen or to have a consultation over the phone if you're not really sure if you should be seen or if you just want medical advice. We can do that as well over the phone. You can make an appointment on the portal for a telehealth visit, or you can also make appointments for in-person visits. We just encourage that you come early because we've had situations where students, they want to be seen in person, but they might have just found out that they had COVID. So we just want to make sure that we keep everyone safe and that we know how you're feeling and give you a diagnosis right away.
Awesome. Another, I guess we can just keep working through these, I guess. What are some diagnostic resources on campus? I'm thinking that's more medical focused as well.
Sure. So we're not really an urgent care here at the Wellness Center, and we're not an emergency room. So if you say have an accident or injury on campus and you need an X-ray, well, you're able to see a provider here in our health clinic. We would write an order for you to get an X-ray, and you'd go right across the street to UChicago Medicine. There's all sorts of resources there. If you were to need an X-ray, an MRI, a CAT scan, any advanced diagnostics, although we don't have the machines here, they're located really down the street. So we do have access to higher level of services and diagnostics. It's really just come in, make an appointment, and we'll get you to the right place.
Awesome. Wonderful. Let's see what's next. I'm looking, there's a lot of insurance questions, which I wish we had time for insurance here. So the process of figuring out how to handle student insurance seems kind of intimidating. Can you talk about what sort of information we have to provide in order to get student insurance? Also, do we have to reapply for student insurance each year? So I can take a first stab. So all students are automatically enrolled into UShip, and that's why you would have to waive it before October 14th because you're automatically enrolled into the process. So if you want to learn more, I am going to put the website for our student insurance in the chat because there are a lot of videos on how to sign up, how to compare premiums, how to do all of those complicated things. And so you can go through there and it can give you some information. I saw another question about dental and vision insurance. We do offer that as a supplemental thing that you can enroll in. It looks like I just pulled it up online. We don't have this coming up year's numbers yet, but I can send the link for last year's numbers just so you can see a little bit of a comparison from other options, and you can kind of see what's covered and what makes the most sense. Does that answer that question? Does anyone?
Yes, so I'll just add again, please note that for any unique circumstances or questions that you may have, we do have two representatives on campus for this very reason that they can customize information to your unique needs and make sure that they can provide the right kind of guidance to help you just navigate. So it's all right. We know insurance issues can be really intimidating to just like read through and digest and fully understand, but please know that there is ample ways here to do that in ways that you're able to kind of really digest the information.
Yeah, they really are fantastic. Their job is to advocate for you all. So it's good to have them. And I just put in the chat some dental and vision insurance information along with the student insurance FAQs. Those are really helpful, and they have videos that can also help there. Marianne, it looks like there's a few more questions about COVID and testing positive on campus and kind of what that procedure looks like in the coming year. Can you speak to that?
Yeah, those guidelines are changing, and I don't have the final verdict of what's going to be expected for students that have tested positive. I can say over the past year, we've had a couple of options. One was to isolate in place for those that are off campus. They would stay in their condo or in their apartment or wherever they're residing off campus, and stay away from family and friends. The past year, we have had an isolation dorm down on Stoneleigh Island, down on part of the campus on the periphery, where we have sent students in the past. We had a very robust contact tracing program, but as we know, COVID has changed. And it's really gone from a pandemic stage to an endemic stage. It's not sending as many people into the hospitals, into the intensive care units that as it was doing, back in March of 2020. So we know it's a very fluid situation right now. We're just trying to get guidelines from the infectious disease professionals to learn how to best handle it moving forward. So we're not really sure that we will have the requirement that you would need to go to an isolation dorm if you tested positive. But for right now, if you had a concern that you were exposed or you start having symptoms that you think may be related to COVID, if you have a rapid test, I mean, obviously that's widely available, but again, calling the health center, we do have rapid tests available and the ability to send you for a PCR test right away so that you'd be able to know your status. And be able to isolate from family and friends. Hopefully there'll be more information that's posted. But for right now, we're still working out the logistics of what to expect in the fall semester.
Thanks, Marianne. And then you did just mention PCR testing. There's a question about expenses for PCR testing and cost. Do you have any information or knowledge about that?
Yeah, that's a good question. I don't think there's a charge for that. And certainly the rapid test that we do here at the Wellness Center, there's no charge for that.
Thanks, Marianne. Another question for Marianne. UChicago, is our health system connected in any way to North Shore or Illinois Bone and Joint or other local health systems?
Yeah, no, that's a good question. I mean, in the past, we've been able to refer to those organizations, especially if there's a relationship. That's a question that I would probably send to our nurse navigators or to the USHIP representatives here on campus. But if you do have a specific question, I would actually call the Wellness Center and we can try to get you to the right resources.
Thank you. Another one, I think this probably goes for both mental health and medical. For students who are on long-term prescriptions, can they get medicine and continue their prescriptions on campus?
So I can take that regarding psychiatric medication. So this comes up a fair amount if you have a long-term psychiatric prescription that you're looking to continue. It's actually critically important. One, please check and see how many refills you have and what the expiry dates on those refills would be, and make sure that you have adequate medication from your previous provider to just bridge your care for a bit. And then you do need to call our Student Wellness Center, so you'll need to set up a couple different appointments, one with just one of our clinicians to just begin the process, who will then refer you for a psychiatric evaluation. So you have to really think about this as transitioning your care, and the psychiatric provider will make an evaluation, likely get some releases from you, coordinate the care with your previous provider, and then develop a treatment plan to continue your care during your time at the University of Chicago. So there's a few different steps that are important. So please get started as soon as possible so things don't feel sort of like really dire and urgent because you're running out of medication. Marianne?
Yeah, no, that's a great point, Neetha. So say you have a medical condition that you get chronic medications for, I would give you the same guidance. Really make sure that when your refills are up, I would make an appointment on the portal for a visit with either advanced practice provider, advanced practice nurse, or one of our physicians. A lot of times when you have that appointment, we review your medications, the indications. We see if there's any additional treatment that you may need. And then we're able to refill that accordingly. So please go right ahead and make sure that if you think that this might be a need, that you get an appointment with one of our providers, and we can get you set up for refills.
Awesome, thank you both. There's another question. If we as parents want access to their health records while on campus, what forms do we need to file? What's the process for that?
So for parents that have, you're saying for parents?
Yes, if a parent wants access to the health records of their student or their child.
Yeah, I think that that would be up to the student. The parent does not have access because that is not their property. It's the property of the student. So it would be up to the student to decide what information would be shared with their parent. So that would be up to the student.
Yeah, so I would echo what Marianne said regarding mental health records as well, that all of the treatment and health and mental health records are really governed by state law and confidentiality requirements. So we are obligated to keep the care as well as the records as highly confidential materials. But if a student signs the appropriate release forms for us to provide access to specific kinds of records when indicated or needed, we are certainly able to do that. So we would really encourage for parents, I think, and families who want to be involved in their students' care, is talk to your students and kind of really discuss what this is going to look like as they transition to becoming kind of young adults in a university environment, and have this conversation with them and really figure out what that involvement is going to look like. And that is something that then the student can initiate and engage with us and have those conversations, so we can appropriately set things up to make sure that all of the parties who need to be involved are appropriately informed and involved.
Awesome, thank you, Mitha. And Samuel just put a FAQ in the chat for folks to talk about medical information and medical care for their students who are 18 plus. Awesome. So another question, how do you help students who are more vulnerable or to more dangerous or long-term outcomes from COVID-19?
So if there's a concern about, having COVID and having lingering symptoms, that is something that we could manage here at the Wellness Center, or at least get you the information or referrals that you would need. I'm not sure if the student is concerned because they've already had COVID, or they're more concerned that they're going to get COVID. Obviously either situation, we can certainly give the student guidance on what's the best way to protect themselves. Again, usually that's by vaccination. We do have vaccinations here at the Wellness Center. We have provided the primary series, and we've provided boosters. So that's always an option here for your health, is to get double vaccine boosted. We don't have what the guidance will be from the university as far as additional vaccinations. And I think that, again, the situation with COVID continues to be very fluid. So hopefully when we get more information about how to manage COVID in the fall, we'll be able to update that information on the portal. But again, if you have any other additional concerns or questions, I would just encourage you to make an appointment with a provider, a health provider.
Yeah, and I would just add, thinking about, I know someone you put in the chat that you're concerned about both Something that has been a larger conversation with a lot of our students in these past 2 years is just thinking critically about what boundaries are, what their level of risk is, what level of risk they are comfortable taking on. So I would encourage you to have a conversation with your student, just to have some self-reflection. For me personally, I'm immunocompromised, so I generally wear masks around people that I don't know, even though it's not required. So, having a conversation, making a plan for what they can do to make themselves feel as safe and comfortable on campus as possible. I think that's just something that's really important to think about before you come onto campus, because it gets really busy when you first get here. So we do have folks walking around campus with masks all the time. In the Student Wellness Center, we're required to wear masks, so it's not uncommon, and it is something that we do take really seriously. Marianne, another question for you. Medical center, do you do diagnostics for students, such as providing medical tests for chronic issues that are not emergent, like a student needing an MRI, X-ray, kind of the things that you would send over to UCM?
Yeah, again, I would encourage you to come in for an evaluation. Obviously, we want to make sure that there is a medical indication for you to be getting that test. We certainly don't recommend testing or screening that, isn't well vetted out through governmental bodies that or best practice guidelines that are stating that this is a disease or a condition that we should be screening for in this particular age group. So again, if you feel like you need some workup for symptoms that you've been having, or you're concerned about your health, or you've had a test in the past that say needs to be repeated, we can certainly facilitate that. We just want to make sure that we do a thorough history and physical examination here to make sure that particular diagnostic test or lab is warranted. We also want to make sure too that it's covered by insurance. Sometimes there's a more complicated diagnostic process that we have to go through, and sometimes some tests may or may not be covered fully. So we don't want anyone to have any surprises. We really encourage to get that information up front, so that you'll know what would be potentially covered or maybe not covered, or that might require a copay.
Thanks, Marianne. Another item, are international students required to get a health check before arriving on campus this year?
Yeah, that's a good question. Not to my knowledge. Not to my knowledge.
As of right now, the university is not requiring that.
Yeah, thank you, Sam.
Another question for Mitha. So for mental health concerns, how does the student health services work with the school or faculty to help students when it comes to mental health concerns?
Yeah, I can start, and then Emily, perhaps you can share a little bit about ways that you partner as well. So in a variety of different ways, a lot of times the staff and faculty are the first line point of contact with the students who are noticing concerns, signs, symptoms, etc. So we try to ensure the best that we can that all of our staff and faculty are at least aware of our services and have the ability to provide the needed linkage and refer students to us. And that happens throughout the year in a variety of different ways. We are also always available as consultants and as experts to just talk about trends and provide any needed consultation on specific issues that come up throughout the year about various student concerns and needs. And then I know through our health promotion service, we do a lot of collaboration and also provide the mental health first aid training.
Yeah, so we, mental health first aid is it's almost like a CPR class, except for mental health concerns. And we work with faculty and staff to train them so that they know how to recognize the signs and symptoms of a mental health concern, so that they feel well equipped to help support their students if they come to them in a time of need, or if they recognize that maybe there's something a little off, or if they're a little concerned about a student. So that's one area that we work really closely, just so our staff and faculty are equipped equipped to help support our students, even if it is just referring them over to UChicago Student Wellness. On the other end, we also work within specific departments and divisions to work with the faculty so that we can educate them on some of these concerns. So there's definitely a larger conversation on campus on how we can support the mental health of our students so that you all can thrive and continue to be fantastic.
And there's a lot of well-being initiatives, I think, developed in collaboration with different departments and different services on campus. So again, we really try to meet the students' needs in a variety of different ways and make sure that our community is engaged.
Definitely. I see there is a question in the chat about dental services. To my knowledge, we don't have dental services within our department, but I don't know if Meetha, Marianne, if you have any other ideas on if a student needs dental services, what that process would look like.
Yeah, again, I would probably have the student call the Wellness Center and get in contact with one of our nurse navigators. Again, I don't believe this is a covered service. We don't have dental on site, which I know that some of the larger universities do, but Hyde Park has, we have some local options. If the student is really concerned about dental care, or if they need an evaluation or a cleaning, we could at least get you to the right place.
And then there's one other question. Are there work study options available for students that have any certifications in healthcare?
That's a really good question. I'm not really sure what certification that they have, but again, I think it's certainly worth reaching out and seeing if there are options, if not here, someplace on campus. I don't know, Sam, do you have any knowledge of work study resources or programming, or who oversees that?
Yeah.
Actually, I wonder if, if I can, that there's other ways. So there may not be work study options, but I know undergraduate students can get involved in an array of different peer initiatives through our health promotion. Again, it's hard to know exactly what kind of engagement and programming and services you're looking to get involved in, but there are other ways that you can contribute and get involved if you're passionate and wanting. But Sam, you were going to say something about work studies. So
yeah, I just kind of threw it in the chat. This is not necessarily encompassing all of kind of, what Meetha just touched on, not every single opportunity for on-campus or around campus employment. But if you're specifically curious about federal work study employment, specifically, it could be in the healthcare field. It doesn't necessarily need to be, of course. We have many, many options for that. I would click on that link. It has to do with our financial aid office primarily, and also be on the lookout for our module and newsletter number 5 next week that are focused on financial matters. And that will also touch on work study programming and availability for you.
Yeah, and then just speaking to what Meetha mentioned, we do have a ton of different ways that you can get involved. If health and well-being is something you're passionate about, I will put the link in the chat for different ways that you can get involved with student wellness. But we have peer health advocate groups. We have 3 separate groups that focus on different health topics. They do workshops, they do education, they do outreach with our campus community. So they're kind of our boots on the ground to go and share the good word about health and well-being. We also have WellSARs. So if you're going to be living on campus this year, we have representatives in each of the houses that are almost like liaisons for student wellness into the houses. And we have usually at least one from each house, but if you're really passionate, there can be a few. And your job is really just to help connect your fellow students with other resources that are on campus. And we meet like twice a quarter, so pretty low bar, but it's a way that you can kind of serve your community in that way. We also have a wellness advisory board, a student health advisory board. So we've got a lot of different ways to get involved if it's just something that you're passionate about and you want to volunteer your time. Awesome. I think that's all the questions. I think we answered the mental health concerns one that I'm seeing here. So if anyone has any other questions, great. If not, I'll hand it over to you, Samuel.
Fantastic. Well, again, thank you all so much for being here. Thank you to our panelists, Meetha, Marianne, Emily. Greatly appreciate it. I learned a lot throughout this, so I hope that everybody else watching did as well. And again, as I said before, of course, you have the contact information that Emily placed up there on the Student Wellness website. You can find all of these great resources, and this webinar was recorded. So if you want to watch it back, if you missed a certain part, if you wanted to just hear something again to better understand it, it will be uploaded on our website within the week. And so that is just college.uchicago.edu/CPO. Thank you so much for being here, and we hope to see you at our next panel. Bye, everyone.
I
I
Everyone.